Hi everybody, my name is Elena Davis and I'm one of the co-founders of Testing for Pease along with Andrea Miko and Michelle Dalton. We'd like to get your input on a new study we're proposing together with researchers from Silent Spring Institute and Northeastern University to investigate some of the possible health impacts on our children from the contaminated water at the Pease International Trade Port. If you're a parent and you or your children were exposed to contaminated water at Pease, we would like you to watch this short video and then fill out a brief anonymous survey. We would like your feedback to make sure the study is appropriate for our community and addresses your concerns.
This is Andrea Amico from Testing for Pease. When we learned about the contaminated drinking water at the Pease Trade Port in 2014, we were immediately concerned about the possible health effects of these chemicals on our children who attended daycare at Pease. The chemicals, called PFAS, or what we used to call PFCs, came from the AFFF firefighting foam that was used at the former Air Force Base. PFASs are extremely persistent and have been linked to a wide range of health effects, including cancer, low birth weight, immune suppression, thyroid disease, and developmental effects. In 2015, we formed the group Testing for Pease in order to more effectively advocate as a community. Since our formation, we have successfully advocated for continued blood testing, as well as the installation of a drinking water treatment system to eliminate PFASs from the drinking water at Pease. About 1,800 adults and children who drink contaminated water at Pease have now had their blood tested, and results show elevated levels of PFAS chemicals when compared to the general population. Now we'd like to know if there are lingering health effects from past exposures in our children. Courtney Kerrigan, a Portsmouth resident and researcher, will now tell you a little bit about the proposed study.
Hi, my name is Courtney Kerrigan. I'm a researcher at the Harvard T.H. Chan School of Public Health. This presentation is intended for the community at Pease Trade Port that was exposed to drinking water contaminated with perfluoroalkyl substances, also known as PFASs or PFCs. In collaboration with the community, NGO, and academic partners listed below, we prepared a grant that, if funded, would have the following aims: determine impacts of PFAS contamination on child immune function, develop an online network to provide resources and data to PFAS-impacted families, facilitate connections between communities, and engage with physicians, and interview individuals in impacted communities to understand the personal impacts of dealing with PFAS drinking water contamination. Some of the health effects that have been related to exposure to PFCs, particularly PFOA and PFOS, are high cholesterol, decreased immune response, altered mammary gland development, decreased burst size, and accelerated puberty, and certain cancers, including testicular and kidney cancer. Last year, the National Toxicology Program issued a report stating that PFOA and PFOS are presumed immune hazards to humans. This is based on antibody response suppression in animals and humans for both PFOA and PFAS, reduced infectious disease resistance, increased hypersensitivity related outcomes, and increased autoimmune disease incidence in humans for PFOA, and suppressed disease resistance and natural killer cell activity for PFAS. For example, a study in Norway found that children whose blood had higher levels of PFAS produced fewer antibodies to rubella vaccination at 3 years of age and had increased frequencies of the common cold and gastroenteritis. Also, children with higher blood levels of PFAS were found to produce fewer antibodies after vaccination for diphtheria and tetanus compared to children who had lower levels of PFAS in their blood. In this series of studies, vaccination is being used as a model of immune function. If the body produces fewer antibodies after vaccination, then this is thought to be a marker of decreased immune function. In that study, these associations were observed for PFOA, PFOS, and PFHXS. And one thing I noticed was that the maximum concentrations of PFHXS were about 4 times higher in the Pease children compared to the Faroese children, which is the population in that study. Also, the 75th percentile concentrations were about 10 times higher among the Pease children compared to the Faroese. Additionally, about 40% of the Pease children were above the 95th percentile of the general population as measured by NHANES and reported by the New Hampshire DHHS in their 2016 report. And this is consistent with other populations, and it appears that it's related to AFFF, the aqueous film-forming foam that was released at the base as a source of contamination that contributes to this elevated PFH excess levels in the blood. That series of studies also reported an elevated exposures in the first year of life due to ingestion of breast milk. So children at Pease can have elevated exposures due to ingestion of breast milk, as well as formula being mixed with contaminated water at Pease. The first year of life is also a sensitive developmental window for the immune system, because this is the period during which the immune system is developing. And for this proposed project, we plan to work with communities at Pease Tradeport and Hyannis, Massachusetts, both which have PFAS, contaminated drinking water from historic use of AFFF. The proposed immune function study would test whether children with higher blood levels of PFAS from AFFF contaminated drinking water produce fewer antibodies to diphtheria and tetanus, and whether they're more likely to have clinically relevant suppression of antibody production compared to children with lower levels of PFAS in their blood. We have two study designs to choose from. Both involve a blood draw 1 month after the child's diphtheria and tetanus booster vaccination. The first study design also involves a blood draw prior to the DTaP booster vaccination. This allows us to calculate a change in antibody response and reduces the amount of noise in our data. In this way, we're able to see a clear effect with fewer number of children. The second design involves only the blood draw 1 month after the DTaP booster vaccination. So this analysis would rely only on the post-booster antibody level and is less able to detect an effect even when we enroll more children in the study. We'd really like to know what you think about the proposed study. Is it useful? Do you have thoughts on design 1 versus 2? If one of these studies is funded, would you potentially be interested to enroll your child?
As parents, we understand how stressful it can be to take a blood sample from a child, so we'd like to ask you, if you have a child who will be eligible for our study, would you consider enrolling him or her in either study design? Please use the link we have provided to take a minute to complete the anonymous survey and provide feedback. On behalf of Testing for Pease, Silent Spring Institute, and Northeastern University, we thank you for your participation.